We take you to the Nelson Mandela Bay municipality where the Kwazakhele Clinic has been temporarily closed, and this is due to concerns about criminal activity targeting the facility. The provincial health department made the decision after the community alerted staff to potential threats. The department assures that residents can access healthcare services at nearby clinics during this period. Newzroom Africa's Sipha Kema now joins us live for an update on the story. Sipha, so what happened here?
Well, as you mentioned, Aldrin, that the Department of Health received reports from the healthcare workers from this facility, Kwazakhele Clinic on Bishile Street, telling them that they were informed by community members that there would be a possible robbery that will happen here. And that's when the clinic had to close on Saturday. Now, the clinic normally does operate on Saturdays, as well as it wasn't opened yesterday as well. It was not opened the entire week. It had to be temporarily closed because of these reports that came from the community members. But we're going to touch on that issue just now, Aldrin, seeing how much crime is affecting services in the Nelson Mandela Bay Metro. I mean, people like this gentleman next to me, Mr. Tozamile Ngwekeba, who came to get his medication at the dispensary here. Unfortunately, he came to close the gate, and a padlock is what welcomed him, Aldrin. We're going to talk to him now about that. I mean, we've seen a number of other people coming and having to turn back, mothers with children, fathers with children, some people who have some form of disabilities as well. Let's bring in Mr. Ngwekeba. Tata, ubuzolanda namhlanje i-treatment yakho, ubuzobona ugqirha uzolanda nepilisi zakho. Ngoku kuvaliwe uzakwenza njani? Ithini into?
Ndizawulinda lo mhlawuvulwa ngawo.
Ayikho enye iklinikhi onoya kuyo?
Ikhona.
Indawuni?
Ngezantsi.
Uhamba ngeenyawo tata? Awuhlali kude apha?
Hayi, ndikho kude.
Kodwa lena iklinikhi yona ikude lena uzoya kuyo ngoku?
Hayi, kude.
I mean, you could just imagine, Aldrin is an elderly patient, a chronic patient that has to come and get his treatment from the facility. And he can't right now. And he also uses a walking stick to walk. We've seen him walk. And he has to now go to the other side, which is a clinic that's a bit far off. Now, we also see another elderly lady. Mola mama kunjani? Dukubona ufika ngoku uyangena?
Lamfano kuba kuvaliwe.
Kuvaliwe mama.
Yintoni mntanami Thixo wami ngoku?
Khange niyazi ubuzolanda i-treatment?
Ndize nakugqirha apha imini yam.
Ibisuppose idate yakho namhlanje.
Namhlanje.
Ngoku mama xa ungaphumelelanga apho uzoya kweliphi icala?
Ichangana nayo ikhona.
Ikude nje ayikudanga ichangana?
Kude. Ndithini ke mntanami?
Yeah, I mean, Aldrin, we're seeing now the effects of crime and what they're doing to communities, and more especially those vulnerable, the elderly, children. You can just imagine the two elderly patients that were supposed to come for their dates to see the doctor and fetch their treatments today now have been inconvenienced, told that it's closed. And the next clinics that they have to go to is far off, as you can just imagine, Aldrin. But there's another subject we're going to touch on when we come back at 9 o'clock, Aldrin, where we spoke to the District Commissioner of the Nelson Mandela Bay Metro, General Ngata, who said that these allegations of criminal activities that are said to have been targeting this clinic are actually null and void, Aldrin. So we're going to look into that exactly and what he says about that and where these warnings actually stem from.
Okay, Sipha Kema there joining us from the Eastern Cape as we continue to focus on local government, including issues relating to crime and safety as well as health. And just look at that particular incident that has happened there and those patients walking to the clinic only to find that the clinic is actually closed.